Ball scorpions. Place a lacrosse ball or a softball into the pec tissue. Extend your arm out to the side and keep your wrist above your shoulder. Bend into the opposite leg and twist into the side that you have the ball in the pec. Keep your breathing steady. You might feel a little bit of discomfort, and that's normal. If it feels painful or sharp or burning, then maybe back off or don't do the movement. It's normal to feel a little bit of discomfort here, almost like a bit of a deep tissue massage. After you've done one side, make sure to do the other side as well. Keeping the ball in the pec and twisting and untwisting into that side while breathing steady. While using a lacrosse ball, you're going to place it a couple inches below your rib cage on the outer 25% of your abdominal wall. The muscle that we're looking to mobilize here is called your psoas, and the psoas runs from the top of your femur, your leg bone, to your lumbar spine, and it gets very tight from sitting in a closed hip position. So what we're going to do is we're going to place that ball a couple inches below your rib cage on the outer 25% of your abdominal wall. And then what you're going to do is lay on your stomach, breathe into the stomach, and allow the ball to penetrate in a little bit. You might have to move back and forth left and right a little bit until you find the psoas muscle. You'll know it because it'll feel uncomfortable. However, if anything's extremely painful, come out of the movement. Another note, don't ever place the ball in the center of the stomach or in the sternum. Always on the outer 25% of where your abdominals would be. From here, take a big belly breath into your diaphragm. Keep the hip bone pinned to the ground and then draw the knee off the ground. Even if it's only a centimeter or an inch or two, some people won't even get the knee off the ground, and that's okay. You just want to keep breathing into that lacrosse ball to help to relax the psoas muscle. The psoas muscle is connected to the lumbar spine. So when you sit a lot, the hips get tight, that psoas muscle shortens, and then when you stand up, it pulls the low back in, which can contribute to a lot of hip dysfunction for one, and also low back pain for two. So what we're going to do is breathe steady here, inhale, slight lift of the leg, and back down. So it's almost like an active release for the psoas. After you've completed one area, you can roll the ball down an inch or two and see if you can find another area that needs some attention. Spend about a minute each side here, pre-workout and also on off days.